I was in my early 30s when I was first diagnosed with polycythemia, which is one of the MPN types of cancers. And that was a very shocking thing to happen. I had a routine blood test that came back and showed that some of my blood counts were abnormally high. And with polycythemia, it's the condition where you're producing excess red blood cells. And started to be treated at McMaster University Hospital. And after a few years of just kind of routine treatment, I was then transferred as a patient over to Princess Margaret because the doctor at McMaster thought that there was more innovative and new types of treatment and clinical trials that were going on in regards to MPN groups of cancers. And I was told at that time that there's a very rare chance that polycythemia could evolve into myelofibrosis, which is a much more severe form of cancer. And they needed to do everything they could to try to prevent that from happening. I started being treated at Princess Margaret under Dr. Gupta, Vikas Gupta, and the treatment was very good. It was more or less just kind of routine check-ins every quarter, every 3 to 4 months. And occasionally I'd have to have a phlebotomy to let blood out. And I was on hydroxyurea to treat the condition. But unfortunately, after about 8 years from the initial diagnosis, it morphed into a myelofibrosis. And this was very shocking. And I was having some severe issues with the symptoms. When this occurred, I was told that it's now in a fatal form of cancer, and it's progressed very rapidly, very kind of acute-like conditions that were rapid, and that they had to be aggressive in terms of the treatment or I would not survive the cancer. And they gave me about a 50% chance of survival if I did the transplant. And so when I was around 43 or so, all of this drama related to the condition happened. And it was very shocking for me, very shocking for my family. I had 2 young boys, a 4-year-old and a 6-year-old. Trying to figure out how to explain to them was very difficult. It was hard on my family, but we felt that we were in the best place in terms of where we could get the best kind of treatment. That's more or less where I sat at the early stages. Before I was diagnosed with the polycythemia, I was more red-faced. My skin complexion was very red. I was kind of short of breath. I kind of put that on as being a little bit of out of shape, being older, this sort of thing. But in fact, it was related to the fact that my blood counts were in disarray and the conditions of my blood cells were not normal. And I was experiencing things like night sweats, bone pain, fatigue, things of this nature. This was right around the time that I was diagnosed with the polycythemia. And then when I got into doing the phlebotomy treatments and on the hydroxyurea, that really helped the condition quite a lot. But then in the latter stages of that, before it transformed into myelofibrosis, I started to experience much more severe symptoms that led to them doing bone marrow biopsies and trying to determine if the disease has actually progressed. And those conditions were like excruciating bone pain. I was out of breath very easily. I was getting sick quite often, like a cold or nasal infection would last weeks and weeks before it would go away. And I was having to sleep on towels in my bed because I couldn't go a night without drenching the sheets with night sweats. And these were some of the conditions that I was experiencing when they finally concluded that it had transformed into the fatal form of myelofibrosis. When my wife and I met with Dr. Gupta the day that they got the results back, or were sharing the results back with us after the bone biopsy to confirm that it was indeed myelofibrosis and what kind of status it was in. He was very clear that it was unfortunately not a great prognosis. He told us when we met with him in clinic that my life expectancy would be maybe 2, possibly 3 years without any other radical form of treatment, such as a stem cell transplant. The 2 to 3 years was with all of the conventional treatment and standard of care that they had. And so having a 4-year-old and 6-year-old, of course, we were very saddened by that and shocked and trying to think about and be accepting to other forms of treatment. He said during our visit that there is the possibility that I could do a stem cell transplant and I would have to qualify for it, but he thought that that was quite possible to do so because of my age and relatively decent condition, albeit having a terminal diagnosis. The other thing is he hinted at there might be a possibility of participating in a clinical trial at Princess Margaret, and we would have to go in stages. And so, when you're diagnosed with something like this, you want immediate answers, but we had to wait weeks and maybe a month or two before we knew that we could do a stem cell transplant. And in fact, that we could do it under clinical trial. And I was offered both forms, the standard of care transplant or doing a new innovative approach to a stem cell transplant that hadn't been done before anywhere. And I would be the first patient in Canada, the second patient globally to have this done, because there's another patient ahead of me in Mount Sinai Hospital in New York, I believe, or maybe Boston. And I peppered them with questions, and there was a committee involved in selecting me as a patient for the clinical trial. But what came back more or less was that my chances of survival would go from about 50%. In fact, they told me it was numerically 48% chance of survival to higher chance of survival. And I kept asking, well, what percent higher, or what do you give it? And it was a very hard thing to answer because they hadn't done it before. And I actually had one of the doctors that met with me privately afterwards said that he thought it would be above 70% chance. And if I was him, it would be a good choice. And he knew I was a math guy, an engineer, analytical, looking for answers, lots of questions. And it was good. He gave me the straight facts as he saw it. And I elected to proceed with that. Dr. Gupta gave me a call to give me news that I was eligible. And it was a very emotional day for me when I found that out. I did a lot of research as much as I could, but trying to stay out of the weeds of all the crap you can read online about medical conditions. I was more or less trying to research about how to improve your health, how to improve chances of success when you're having medical procedures done. And a lot of it came back to like physical fitness, healthy eating, low stress, things that you would kind of naturally be drawn to. I did learn from Dr. Gupta and some of the other doctors that they do have data that strongly suggests that your overall physical condition improves your chances of success as well as your mental conditioning. And they emphasize that. So I happened by chance to read a book by Chris Hadfield, the astronaut, that was called An Astronaut's Guide to Life on Earth, just by chance. And it's strange how this is related to this. However, when I read the book, he talked about a scenario of imagine you're walking down the street and NASA comes along and grabs you and straps you to the top of a rocket and starts counting down 10, 9, 8, etc. How scared and ill-prepared you would be to be blasting off and going into space. And the chapter that this was in a chapter that was related to preparedness. So I focused on being as prepared as I possibly could be for the stem cell transplant. Unlike some patients, you don't have a lot of time to prepare, but I had 8 months until my stem cell transplant was scheduled. And I worked on weightlifting, yoga. I spent a lot of time working on my mental health, like as much mindfulness as I could learn. And I practiced this both before, during, and after the transplant. I would envision myself having success, like the doctors walking into my room and stating that the transplant was successful, that I was receiving excellent results in the blood work post-transplant, all these kind of visual things, like a skier would visualize going down the hill and going around the gates. My gates were like the blood reports, going to clinic, having the transplant, them finding my donor. These are the ways that I prepared. It was both very much a yin and yang, the doctors and the nurses being like the yin pulling me across, and then the yang being me pushing. So a push and pull, me pushing with physical fitness, health, and mental health to try to make as much of a kind of cohesive solution to increase my chances of success. And it's been commented on by the doctors that that preparedness was critical to how well I responded in the end. On the day of the transplant, I was in hospital for about a week, maybe 10 days beforehand. This is where they were doing chemotherapy treatment and other forms of drug treatment that were very specific to the type of transplant I had. As I mentioned, I had the first stem cell transplant of this type ever done in Canada and the second worldwide by this point in time. I was in the hospital, 14th floor, Princess Margaret. It was my wife, myself, and then my primary nurse that was there almost the entire month caring for me, as well as other nurses. And she brought in a small bag of blood that looked almost like a blood transfusion, and it was deep, deep red in color. And it was all of the stem cells that they had just withdrawn from an anonymous donor that we believe was at the hospital, because that day they were saying, okay, the transplant's happening at 10, and then it was supposed to happen at 1, and then it was 3 o'clock. And we think because there were some delays happening there at the hospital with processing the stem cells. And then they came in the afternoon, and I had intravenous line. It was a Hickman line that went through my neck down into my heart. So it was rather kind of uneventful procedure. When you hear of stem cell transplants, sometimes they're called bone marrow transplants. In this instance, it was more of a passive procedure, but it was after a week of chemotherapy where they killed off all my bone marrow. So I had no immunity, no immune system. I had no bone marrow that was active or live. This was a one-shot deal where they now connected the bag of blood of stem cells, and they put it on my chest. I said a prayer with my wife and the nurse, and away we went. And they administered the blood or the stem cells. It came into my body, and I actually quite quickly had a reaction, and that was more or less like a anaphylactic shock type of reaction, like an allergic reaction. And it scared the pants off of me. I thought everything was going wrong. But apparently this happens sometimes because you're introducing a foreign body into your body. And they got that under control quite quickly. And the stem cells then started to work their way into my body. And apparently they would go, for example, like to my spleen, and then eventually would make their way to my bone marrow, these new stem cells. And my bone marrow was killed off through the chemotherapy. So it was kind of like fertile land, so to speak, where they were planting new seeds. And one of the doctors that ran the transplant clinic at Princess Margaret used an analogy that stuck with me to prepare me for the length of time now that I had to wait for results to happen. He said, Michael, what we're doing is trying to grow a forest from seeds. And you have to, nurture the forest and wait for it to start to grow and respond until you get all the foliage and so forth. And so I kind of visualized that as happening in my bones, with the stem cells going to my legs and my other bones and planting and starting to replicate and grow. That was the day of the transplant. The immediate response, other than the allergic reaction that I had, was rather muted. It was scary also because you're wanting to see results right away. And we had a calendar. The nurses had a calendar on the wall where they would write my blood stats on the wall. And one of the things they were looking for was a particular blood stat that tracks basically how immune you are to outside infection. Then I got to a point after about, I think, 2 weeks where that indicator started to rise, and it was showing that, okay, it's starting to take hold. But an interesting fact of my transplant was that I had a different blood type than my donor. And when they match someone for a stem cell transplant, they're matching their tissue type, not their blood type. And so I had a donor that had the same tissue as I did, but had a different blood type. And what that meant was that it was going to be a longer recovery until my body started to produce blood on its own. And so I went almost 6 months to the day before we got test results that showed that my body was producing its own blood, not just it's having immunity, but producing its own blood. So I was having 2 to 3 blood transfusions every week. And in total, I had somewhere in the range of 50 to 60 blood transfusions until about month 6 that I actually started to produce my own blood. And that was a great day. One of the things that I returned to as quickly as I could was my routine of going to the gym and weightlifting. I really enjoyed that. I spent a lot of time doing yoga, and I returned to that after about 8 months or so of doing the transplant. I was strong enough for that. One of the things that I really kind of grew into, studied more of, was mindfulness. And I felt that helped more or less with the mental aftermath of the transplant. There is a significant amount of stress, being given a terminal diagnosis, but then given a chance at life through a new clinical trial that could totally rechart the prognosis into being completely survivable and curable. And that's in fact what happened, is that I was cured of the disease. There's no sign of the gene mutation. And if you looked at me like you are today, you wouldn't know that I went through years of having to recover from this type of cancer. Dealing with that mental aspect was helped because of doing the mindfulness. I did a mindfulness program after I had the transplant, and the mindfulness program I felt was extremely helpful because it taught me how to control those what if thoughts. What was the biggest kind of mental concern was, what if it comes back? This type of concern. What if it doesn't work after a year? What if it doesn't work after 2 years and I'm back in the same situation? What about my kids and my family and this sort of thing? And instead of pushing those fears away and those thoughts away, mentalness or mindfulness is about embracing those thoughts and embracing those feelings, actually feeling what it feels like you embrace it and acknowledge it, and it helped kind of ease it and get through it, and through specific exercises and so forth. And then as well as time went by, I was able to be more confident in the success that we had achieved. Clinical trials are so important to the advancement of the standard of care. So what standard of care is you have a certain condition, the medical procedures for treating you are bound by a set of procedures and guidelines that are referred to as the standard of care. Clinical trials are created to help advance the standard of care. In my case, I had myelofibrosis, and there was a specific way of having a stem cell transplant for patients with my condition. Going under a clinical trial meant that they being the doctors and the nurses, could administer a new methodology under a trial basis to advance and augment the standard of care, to do it differently, because they strongly believe, and there's medical evidence to support, that the result will be no less worse, in fact, probably better than the standard of care. That's what they're trying to achieve. And so I'm just 100% behind the need for funding research and continuation and growth of clinical trial care in our health system. The biggest lesson I learned from this experience is preparedness. The idea of preparedness was so critical for me. I was fortunate to have the runway to spend time to work on my preparedness for the stem cell transplant. Some patients, you have a tumor, they have to operate real quickly, and you don't have that much time to prepare. Other patients do. And if you have the opportunity to prepare, spend it on your physical health. If you have stronger muscles, it means you have stronger heart, stronger lungs, stronger organs to be able to combat and fight diseases such as this. And as well, if you're in better physical condition, when you go through cancer treatment, you get worn out, you get brought often to the edge of no return in order to combat the cancer. So if you have the opportunity to improve your health and improve your fitness to a much higher level before you undergo such a procedure, invest the time in it. It's worthwhile. And as well, invest your energies in your mental status and your attitude about care. As I said earlier, just like Olympic skiers visualize themselves winning the race, going down the course, skiing and going through the gates, you as a patient can visualize having success, trying to influence your body's systems to work better to help your recovery. It's push and pull. It's the pull of the doctors and the nurses and the medications and treatments that you're on and go through. And it's the pull as well, the push and pull of you contributing by working on your mental and physical and emotional health to get you through such a traumatic event. And preparedness is the one word I'd use to sum that up. The pharmaceutical industry plays a big part in clinical trials. Clinical trials are about procedures that might be related to instruments, devices, things of this nature, as well as medications, chemical therapies, and so forth. And the pharmaceutical and medical industry plays a big part in that, as do the hospitals and the patients that received those clinical trials. The pharmacy industry was critical in terms of my clinical trial. They were a direct partner in this. It was Princess Margaret Hospital, the doctors that were running the program, and the other hospitals globally that were participating in the trial, the patients, and then the pharmaceutical company that was providing the medication that was being used during the preconditioning phase before I had the stem cell transplant. I mentioned that I had to wait 8 months for the transplant. I specifically had to wait 8 months because there was 8 months of medical therapy, medication therapy that I underwent before I had the transplant. That's why I waited so long. And so the role of the pharmaceutical company with the hospital and the patient, they're all equally as important. And we're very grateful for their involvement in it as well. There's a number of ways that the general public can help contribute to advancing the standard of care and clinical trials. The particular group of cancers that myeloproliferative or myelofibrosis belongs to is myeloproliferative neoplasms, MPNs. There's approximately 5 categories of cancer. I believe it's 5 that fall into this category. This is considered a rare cancer, and there's less attention and focus on it compared to some of the more well-known cancers that you hear about in the media and through public awareness campaigns, because they have a lot more funding available to it. The rare diseases, the rare cancers are the ones that have a much harder time advancing the standard of care because there's less funding available. But there are ways to support this. For example, our group, the MPN Research Foundation of Canada, it's actually called the Canadian MPN Research Foundation, raises funds to specifically donate to research programs that are working towards the betterment of this disease category. We're working towards improving the standard of care, reducing the impact on patients' health, and working towards the potential of cures in this disease category. And through our organization, you can actually make donations that go to the Canadian MPN Research Foundation. We group those donations and then solicit grants from the medical community, which we awarded 2 grants last year that are specifically focused on MPN cancers and research in Canada. And then we put that money to work to advance disease category, the standard of care and treatment.